Assalamualaikum warahmatullahi wabarakatuh. Before our program begins, I would like to remind you to ensure that your mic is muted except during the Q&A session, and if possible, turn on your camera throughout the program. Please download the virtual background that is provided in the chat box. As a reminder, don't forget to fill in the attendance and feedback form. I would like also to remind all of you that there will be a photography session at the end of the talk. Thank you for your cooperation. Bismillahirrahmanirrahim. A very good morning to all of our fellow brothers and sisters. First and foremost, I would like to take this opportunity to thank each and every one of you here for waking up early and spending your morning with us here today. Now, we will officially begin our long-awaited event. It is a great pleasure and privilege for me to welcome all of you to this momentous event. Praise to Allah subhanahu wa ta'ala for for the help that we are able to gather for our program today. So we highly appreciate your presence in attending this event. I am Nur Farhani Binti Muhammad Latif, your MC for today. In order to get his blessing, please welcome.
Can you hear me, right?
Yes, very much.
Okay, Bismillahirrahmanirrahim. Ya Allah, Ya Rahim. Praise be to Allah, the Lord of the worlds. Peace and blessing be upon our Prophet Muhammad sallallahu alaihi wasallam and his companion, and for those who followed his example till the judgment day. Allahumma ya Allah, on this blessed morning, in conjunction with the 1 month, one industry 12.0 inside of physiotherapy, we beseech thee and grateful toward you in favor of all the infinite blessing to us, your humble servant, to live in a safe and prosperous life. We seek your blessing for a flawless progress of this event from the beginning till the end. We seek your guidance to steer clear of event that would determinantal the progress of this event. Ya Latif, Ya Rahman, please bless us with your tawfiq and hidayah and grant us with a valuable knowledge that will be beneficial to mankind in order to gain your mardatul alamin. Make us your righteous servant that followed your commands and neglect the sinful act. Please forgive us for our wrongdoing. ربنا عليك توكل وإليك أنبنا وإليك المصير. ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار. وصلى الله على محمد وعلى آله وصحبه وسلم والحمد لله رب العالمين.
Amin ya Rabbil Alameen. Thank you very much, Sain, for the dua. May Allah bless this morning's knowledge sharing session to go on without any interruption or obstacles, inshallah. Before we move to the most awaited moment, I will briefly introduce our beloved guest, Sister Atikah Binti Mokhtar, who is currently working at the hospital in Cibasa Hajah Kalsum as head of Secretary Unit. The hospital is located at Klang, Johor. Previously, she completed her bachelor's degree and graduated in 2019, which in Department of Physical Rehabilitation Sciences KHS. The variety in her educational background allows her to understand people and research from many different perspectives. We are very thankful and appreciative to Sister Atikah for accepting this invitation and giving us an opportunity to learn from her experiences. Thus, we feel delighted to have an amazing speaker for today's sharing session. And now, let's have a glimpse on 1 month, one industry talk series 12.0 inside of Secretary. A friendly info for all. Feel free to flood the chat box with any questions during the talk or during Q&A session after the talk. Okay, now get ready to be mesmerized as we have invited a very special guest to share her journey with us. Ladies and gentlemen, give it up for today's special guest, Sister Atikah.
Okay, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. Okay, how are you guys today? Okay.
Alhamdulillah.
Alhamdulillah. Alright, okay. First of all, I want to thank to the SITC for inviting me to be the speaker today. So first of all, I feel so honored because I was invited in this talk. So basically, as you know, I am Atikah Binti Mokhtar. So I just want to share the slide here. Okay, can you see my slide? You can see my slide tak?
Nah, sister.
Tak nampak?
Oh ya, tak nampak.
Kejap Kejap. Okay. Boleh nampak tak slide?
Yes.
Nampak?
Nampak.
my voice is clear or not?
It's clear. Alhamdulillah.
Clear, eh? Clear. Okay, so we have how many participants here?
Right now we have 25.
25 participants. So first of all, I want to introduce my topic today. So my topic will be inside of physiotherapy. But before that, I would like to introduce a bit of my background and experience. So basically, I was graduated in 2019 in Bachelor of Physiotherapy with honours. And currently, I'm working as Pegawai Pemulihan Perubatan Fisioterapi at Hospital Encik Besar Hajar Kasum Keluang. So, pegawai fisioterapi can be translated lah as medical officer rehabilitation physiotherapy. So previously I was working at a private clinic and a private care center, and it is basically a different setting from the government. Okay, so the government hospital I was offered to work with Ministry of Health last year. So basically I just can be considered as freshie lah in the Ministry of Health. Okay, so in the private clinic, what I was I was a physiotherapist, but we handle the patients in the community. And private care center is basically a all folk home. So all folk home, we are treating the elderly patients. We are focusing more on elderly and how to improve their quality of life. And during in the government sector, I'm focused more on the administration because I'm also hold an obligation as physiotherapy head of department, and beside treating the patient, I'm also doing the management side. So beside of manage my staff and also the unit, I'm also treating the patient also. Can you guys hear me?
Yes, Alhamdulillah, we can hear.
Okay. All right. Okay, so that's a little of my experience during my working in the private sector and also in the government sector. I just want to inform you guys, if you have any question during my talk, you just can ask me, okay? All right. Okay. So basically, physiotherapy is one of the profession under allied health professionals. So as we can see here, according to the Majlis Profession Kesihatan Bersekutu Malaysia or Allied Health Professional Council, we have 23 professionals under the allied health professions. So according to this, we have audiologists, dietitians, physiotherapists, and others. So we have 23 professions under the allied health professionals. So starting 24th of March 2020, this year, the profession have been replaced to only 16 profession. One, because we have this ahli science clinical, in the clinical lab clinical side. These all from number 8 to 13 combined together under one profession, which is the medical lab punya side lah. Okay, so it become the 16 profession from 23 profession. So at IUM Kuantan, we only have few courses, right? Courses which in the kuliah of allied health sciences. So is there any kuliah of allied health sciences here? Students, ada tak? Tak ada. So most of you guys are from Gombak kuliah, Gombak ni ya, branch. Betul tak?
Yes.
Okay. Alright. Okay, so we proceed. Okay, what is physiotherapy? So I will introduce about the roles, approaches, and the areas of the practice of the physiotherapist. Okay, for physiotherapy, basically we will deals with the physical disorder by optimizing movement and function, involve the evaluation, diagnosis, treatment, and prevention of various disease and injuries. So in the physiotherapy, we will deal the patient yang ada injuries, yang ada diseases. So we will treat them, we will evaluate them and diagnose whether what is the best treatment for the patients. So it more, kalau kat hospital, we will focus more on the curative treatment lah, curative. Sebab physiotherapy ni dia akan will focus on three things, which is the curative, preventive and also the promotion. So in the hospital sector, we will focus on the curative. We will treat the patient. So we will evaluate, analyze the patient problem, and then we will find what is the patient's problem, why, and then we will treat the patient based on their condition. Okay, so what are our approaches? So the first one is exercise therapy. For the exercise therapy, we will train the patient to do the exercise. Most of us will think that physiotherapy only give the treatment only for patient with exercise therapy. We will just prescribe exercise. Basically, we will give the many approaches such as using the modalities, manual therapy and also education and advice. Exercise therapy ni dia focus only on exercise. We will prescribe the certain exercise for specific problem. For example, so this picture shows that the patient have shoulder problem. So what we are doing, the physiotherapist will prescribe the exercises for the patient to do to improve their movement of the shoulder. So the exercise will be prescribed based on the patient condition. So it will have a specific exercise with specific duration and frequency that suitable for the patient to do lah. Okay. And the second one is using the modalities. So here it shows that the modalities like ultrasound. So the ultrasound and also the TENS. TENS means the electrical stimulation. So the physio will use the ultrasound to treat the patient by using the others machine. There are many modalities at the hospitals or center which are physiotherapists using. So these all are the modalities will be used to treat the patient to faster to heal, to improve the healing process. Okay. So that's for the modalities. Okay. The third approaches of physiotherapy, we will use the manual therapy, means we use hands-on technique. So physiotherapists will manipulate, we are using their hand when we manipulate the patient by using many techniques lah, such as mobilization, can do soft tissue manipulation and others. So many techniques that can be done by physiotherapists to give the treatment for the patient. Okay, that's for manual therapy. Alright. So last one is education and advice. So after, for example, at the hospital, we are giving the treatment to the patient, right? So after we analyze the patient problem, we giving the suitable treatment for the patient, like exercise or modalities or manual therapies. After that, we will educate and advise the patient. So what will we do in the education of the patient? We'll educate the patient based on their problem. For example, if a patient, elderly patient, they tend to have high risk of fall, right? So we will educate the patient how to prevent or how to reduce the risk of fall among the patients. So we will advise the patients what should do and what should not do during at the home lah. So besides that, we will also educate the patient what to do at the exercise home program lah, home exercise program at home. So after the treatment we have given to the patient, we will educate the patient what to do at home, because the treatment is not orang kata short follow up. It is a long follow up patient. For example, this week we treat the patient, and next follow up will be next 2 weeks or next 3 weeks, or in the shortest time is 1 week, within 1 week. So we must educate the patient to do exercise at home also, so that it will faster the rehabilitation. Okay, alright. Understand? You guys clear?
Inshallah.
InsyaAllah.
Yes.
Alright. Okay. So this is the example of the guidance to home exercise program. So the pamphlet we will give to the patients so that they will understand what is the instruction that have been given to them. So this include the exercise that can be do at home. It conclude dia ada dia punya frekuensi, ada berapa kali sehari nak kena buat kan. Okay, so the patient will understand what should do during at home lah. Okay, so they must do the exercise so that when they are coming again to the hospital, the pain and there is improvement lah in their mobility or their in reducing the pain. Okay. Okay, next. Alright. So there are many areas of practice for physiotherapy. So this is just a few practices in the physiotherapy. There are many practices that include for physiotherapy. I just include here just a few of them. Okay. So the area of practice is the first one. The picture here shows the pediatrics. Pediatrics mean we deals with the babies from day 1 to 12 years old. So pediatric means from infant and baby to the adolescent lah, 12 years old. So what we will do is we will deal with the patient that have difficulty yang ada functional difficulty. So we will deal with the patients, help to manage the physical symptom, and then we will treat the problem. For example, for the infants yang ada problem yang delay dia punya development, physical development dia delay. So we will treat the patient based on the patient. Contoh kalau 2 years dah boleh berjalan. Okay, 2 years old, children dah can walk, right? So if they are not able to walk, physiotherapists will help the patients, will help the carer or parents to guide their children to walk. There are certain exercise lah for the patient, for the carer or carer ataupun their parents to at home with their children. Okay, for the pediatric, basically they are more on the playing therapy lah, playing therapy to improve their mobility, to improve their functional, their physical development. Alright, so that's for pediatrics. And then the second one here is the geriatric. Geriatric means we are deal with elderly patients which are 60 years and above. So what we are doing, we will help to improving their quality of life. Will help to improve we will train them to do exercise to improve their strength, to improve their coordination, so that it will help them to be independent at home, to improve their quality of life. So usually patient with geriatric will come to hospital with various of problem. For example, they are not only complain of musculoskeletal, which for example their problem with the muscles, but they only have problem with their mobility, for example their movement. Basically we will train on the problem that the patient have lah. Okay, the third one here is the picture of patient with walking aids. So basically here is the orthopedic field. So patient that have undergone physiotherapy, undergone surgery, pre-op and post-op, the physiotherapy will teach the patient what to do before the operation and after the operation. So usually patients after the operation will have the complications such as limited movement, pain. So as a physiotherapist, we will treat the patients. Okay, we will treat the patient, and this shows the physiotherapist train the patient to walk using the ambulating aids. So basically we will teach the patient how to return to their normal functional. Alright, it's this for the orthopedic field. Orthopedic means we are focusing on the muscle, joint, tendon problem among the patient. So this is for the sport injury. Okay, so physiotherapy also included in the practice of sport injury. For the sport injury, basically physio will work with the sport team. Okay, with the sport team, we will treat the patient based on their condition. Macam ni biasanya kalau ada patient yang tengah during the game patient suddenly fall. So what we should do? The physiotherapist will apply some therapy to rehabilitate and to treat the patient. Kalau kat hospital pun sama lah, sport injury, doctors will refer the patients that have injury related to the sport and then refer to the physiotherapy lah, and then physio will teach the patients so that the aim of the patient will be achieved. The aim is to return back to sport again. So that's the big goal lah for the patients. Alright. So the fifth one, this is the picture of patient basically in ward lah. So what we are doing in the cardiopulmonary rehab, cardiorespiratory field. Cardiorespiratory means we are dealing with patients who have problem with their lungs and heart. So basically physio will teach breathing exercises, we will teach how to do positioning at ward. Okay, like this we have the tools, the incentive spirometry. We will teach the patient to do the exercise to improve their lung capacity. So it will help to improve the patient's lung capacity and then improve their quality of life. Alright, this for the cardiorespiratory. But usually at ward, kalau for the outpatient means the patient will be referred by the doctors to the clinic, physio clinic at the hospital. So what we are doing, we will teach the patient to improve their endurance at the hospital, at the outpatient setting. Kalau dekat inpatient, dia lebih kepada kita nak bagi dia reduce the hospital stay. So that bila dah reduce hospital stay, dah improve dia punya vital capacity, dia punya lung capacity semua, and then they will be discharged. Sometimes they will be have a follow up at the outpatient setting. Bila ada follow up tu, physio will treat the patient untuk next step lah untuk for the outpatient set. Contoh macam COVID patient kan, COVID patient untuk yang inpatient dekat ward. Okay, dekat ward kita akan ajar breathing exercise, positioning semua. Positioning tu maksudnya kita positionkan patient dekat katil macam mana so that to improve, to get the lung getting better. So after the discharge, maybe dia akan ada kat outpatient setting, outpatient clinic. Dia akan diajar how to do the exercise to improve their endurance. Kalau COVID patient pun sama, kita akan diorang biasanya akan ada symptom like shortness of breath kan, diorang akan easily to be fatigue. So bila patient macam tu, we will train at the outpatient some exercises to improve their endurance. Ini tu for the cardiorespiratory, about lungs and our heart lah problem. Okay, so next for the this is the neurological problem. Basically for the practice in the neurology problem with neurological problem, we will treat the patient to improve their mobility. For example, this is a patient with a neuro problem which cannot walk independently. So the physio will train the patients to walk, and beside that they are using the assisting device here, to reduce the burden of physiotherapy itself. So the patient can walk by using the by assisted by the tools. Okay. So in the neurology aspect, we will train in many aspects, such as in the aspect of their coordination, their mobility. Contoh macam patient stroke kan. So in the neurology, we have a stroke patient. So usually stroke patient, they are not able to move by himself or herself. So the physiotherapist will help them to do certain exercises so that they will able to move their hand or their part of the body by themselves. Okay. Alright. Okay. So this only a few other practices in the physiotherapy. Basically, there are lots of practices in the physiotherapy. For example, other than this picture, for example, is for women health, women and men health. Patient with incontinence problem, patient with organ prolapse. So what we are doing is physiotherapists will teach the patient to do exercises to improve the strength of the pelvic floor muscle. So that's for the women health and men health. Other than that is for the vestibular patient. Vestibular, in the field of vestibular, patient that usually that come to the hospital, they will complain about dizziness. They will complain about spinning sensation. So beside then the medication prescribed by the doctors, we as a physiotherapist, we will also train the patient to do some exercises to reduce the occurrence of the spinning or the dizziness. So there are some special techniques, special exercises for the patients to do. Usually we will guide the patient to reduce the symptom of the dizziness or vertigo. Okay. So there are many areas that can be practiced by the physiotherapy, but I just highlight a few of them, right? Can you guys hear me?
Yes.
Yes.
Okay, good. Alright. Okay, next. Okay, this is the picture for the patient at ward during the pandemic. So the pandemic caused havoc in our life, right? So during that time, during the pandemic, we can see the role of a physiotherapist is very important, where the physiotherapist will help the patient to improve their mobility, to improve their quality of life. For example, here patients with COVID, they are trained to walk by assisted by the physiotherapist. So physiotherapist will go to the patient, will train based on their condition. So as I have mentioned before, if they have problem with easily getting fatigue, easily shortness of breath, kan? So we will treat the patient by giving them the exercise for breathing exercises, the specific breathing exercises to improve their lung capacity, so that they will not easily getting shortness of breath. Okay, and also we will train the patient to breathe also. Okay. So other than this, physiotherapists also will guide the patient for the long COVID symptom patient. Usually after patient being discharged, so the patient will refer back to the physiotherapy for the outpatient. Jadi inpatient, kalau kat ward ni kita panggil inpatient. Kalau dekat outpatient tu maksudnya dekat klinik. Maksudnya dah fisio dekat ward, kita dah refer, doktor dah refer untuk dekat ward, bila dah discharge, they will be at the outpatient. Outpatient ni maksudnya patient daripada rumah akan datang physiotherapy. Clear tak?
Clear.
Clear. Okay. Alright, so during the follow up sama jugalah, akan ada exercises for the COVID, long COVID symptom punya patient yang ada symptom tu lah. So we will treat the patient based on their problem. Alright. So the issues and challenges. Okay, so usually in the allied health professional, we have some issue lah regarding this profession. The first one is the malpractice among the individuals who are not credentialed. So they have no credentialing, they have no privileging in the profession of the physiotherapy or in the allied health professions. So they have no certificate to practice the allied health allied health punya field lah. So the malpractice means that they have no certification but they practice the treatment, they give the treatment, they advise the patient, but they have no certificate in these areas. So this is the challenge, the issue and challenge lah for the physiotherapists, because so that the Ministry of Health has established the Act of 774, the Enforcement for Applied Health Professions Act. So what is this act actually? So this act actually is to regulate and control the profession of allied health. So we will the Ministry of Health, and this is under the Majlis Sains Kesihatan Bersekutu. So they will control and regulate this profession to make sure that there is no malpractice among the in the community. So there will be registration. This act was enacted in 2016, and currently in 2020 this March they have an a big modification in the act. So this act will help to give the standard to the profession, allied health profession. So how this act actually help to regulate to control the physiotherapy and others allied health profession. So if there any complaint by the committee or complaint by any person that someone have practiced the allied health profession with no certificate, there will be punishment to them. For example, the punishment will be less than 2 years imprisonment or maximum 50,000 fine. Okay, so this a little bit of this act. Basically, the issue of malpractice among the individuals in the community. They are not trained to be, for example, in the physiotherapy field. They have no certificate to practice the physio, but they can treat the patient. They're giving the advice, they're giving the education to the patient. So basically, it's an improper and illegal lah. Bila illegal, dia akan menyebabkan bila someone yang tak ada certificate, yang tak ada knowledge tentang suatu benda, and they give to the society, it will cause a complication, right? So sometimes it can cause death or injury or others complication. So this all will affect the profession, our profession. So this act play an important role to regulate and control the practice of allied health in the Malaysia. So this is for the enforcement. So the issue is when there is a malpractice within the Malaysia, so this act play important role to regulate and control. So they have a punishment and so on to control the practice. And other challenges is public awareness and knowledge among the community and society lah. So usually in Malaysia we have many traditional treatment like urut kan, mengurut. If patient dia tend to, especially in the rural area macam kawasan kampung kan, diorang tak ada awareness tentang fisioterapi. So they tend to dapatkan rawatan, to get the treatment, to seek the treatment from the tukang-tukang urut kan. So like complication yang dia tak tahu pun, dia pergi cari tukang urut. Macam dia tak tahu apa penyakit tu kan, dia cari urut, nak berurut aja kan. So there is reduced public awareness and knowledge among the community lah about physiotherapy. So bila kurangnya knowledge tentang physiotherapy, they want to see us. They tend and prefer to seek for the kampung-kampung punya treatment. Okay, so this is a challenge for us lah to educate the society. Alright, So as I have been mentioned previously, that physiotherapy involve the curative, preventive, and promotive, right? So prevention and promotion usually obligation of the klinik kesihatan lah. Klinik kesihatan, we have also physiotherapists there. So at klinik kesihatan, physiotherapists will conduct program with the society. They will involve in the society to give the awareness, to give the education to the society. So basically for the klinik kesihatan or klinik kesihatan, they will focus more on the community. Diorang ada juga treat patient dekat klinik, tapi dia more focus on the program with the society lah. Compared to the hospital will focus more on the curative. We will rehabilitation. We will cure the patient at the hospital. Alright. Okay. So what is the difference between medicine and allied healthcare? So basically, medicine field, they will diagnose and cure the illness and injuries. They will diagnose what is the injuries, how the pathologist, right there, the medicine field. Okay, they will diagnose the medicine. So for the allied health, we will focus on prevention and recovery. So other than physiotherapists, the optometrists, the audiologists, so we will focus on the prevention and recovery of the patients. So macam physio sendiri, we will treat the patient based on their injury and illness lah. We will train the patient using the modalities ke, macam tadi kan approaches, using the modalities, physiotherapy punya exercises. So we will guide the patient. Alright. Okay. So dia more on the prevention and recovery lah. Yang ni nak diagnose. Okay. Okay, so what are the benefits to be in the physiotherapy field? So the first one is variety of work environment. So after you grad from the university, you can work in many settings, such as in the hospital. Hospital pun boleh kerja dekat private, dekat government. Tapi government dia ada dia punya kemasukan tu, ada intake dia ada spesifik berapa bilangan yang dia ambil lah. So macam my batch, I'm fourth batch kan. Fourth batch ada 5 orang yang dipanggil lah untuk bekerja with the Ministry of Health. So basically most of my colleague they work with the private center. So they can work in many settings like old folks home, with sport team. So it depends on your preference. If you like to work with sport team, it means that you have patient in the sport injury cases, you will work with the sport team. And if you have patient in geriatric, the elderly, so you will work with the old folks home, for example lah. So other than that, if you don't want to work with with others, you can establish or develop your own center. Okay, so if you have your own center, you can deliver the treatment to the society lah. And you also can doing the home visiting. Home visiting means you go to the patient house. So this is quite high demand lah recently, because physiotherapy at the kawasan-kawasan bandar, dia orang nampak peranan fisio ni macam mana. So when they know the role of physiotherapist, they will use our services. So home service ni quite demand lah from the patient. For example, patient yang ada family members yang stroke kan, so they will have difficulty to go to the hospital, to transfer the patient to the hospital kan, nak pergi jumpa physio, nak kena naik kereta, nak transfer patient tu susah kan. So they tend to have a physio, home physio. So they will physio that doing the home visiting lah. So if you don't want ataupun not interested to work with others lah, you can have your own center for doing the home visiting. Okay. The second one is job satisfaction. So in my opinion, job satisfaction ni like when we are treating the patients, we have our goals and they have their goals. For example, patient with stroke again. Okay, stroke patient, they want to walk independently like previously. So we want them to achieve that goal. We also as a physiotherapist, we want to achieve that goal. So when there is a progression in the patient condition, this will give a great satisfaction for us lah as a physiotherapist. There is improvement in the progression of the patients. So when there is improvement of the patients, patient will be happy. Patient will can return to their activity of daily living. So this will give motivation to us as a physiotherapist to treat other patient also, to have the good progression. Okay, that's for job satisfaction. So other than that, gain knowledge ni macam biasalah. We work in a multidisciplinary team. We work with, kalau kat hospital, we work with doctors, nurses kan apa semua. Bila kita naik kat ward je, kita kena deal with doctors, kena tanya patient ni macam mana. Patient, contoh doktor akan refer pada kita, dia nak patient ni berjalan. So we will treat the patient, we will guide the patient to ambulate the patient so that patient can walk again. Okay, so at the same time we will deal with the doctors. We can gain new knowledge about the rehabilitation, about the physiotherapy, and also others job lah, others job scope. Knowledge from the doctors, knowledge from the nurses, especially in the ward. At the ward, dekat ward biasanya kan ada mesin banyak kan, yang ada setting, macam-macam setting. So when the physiotherapists go to the ward, they are dealing with nurses, they are dealing with doctors, nurses. They know the setting of the machines, for example, how this and that, so that physiotherapists can get more knowledge on the medical side lah. Alright. So this is the benefit lah to be in the physiotherapy field. Basically, when you have skills during the 4th year of study at university life, your skills of hands-on technique, your skills treating the patient, so all of this will be used when you are in the your career nanti. So terutama kalau physio, dia ada skills macam nak buat visiting home, sebab tu boleh buat walaupun macam apa like center, macam center ke apa dah tak hire orang, they can have a home visiting. So home visiting also have a good salary. Okay, 1 hour range dalam 80 to 100 ringgit untuk home visiting. Kita treat patient dekat rumah. So for example, neuro patient, dia boleh sejam saja boleh achieve 80 to 100 ringgit only for 1 hour. So physiotherapy also such a good salary lah in the private sector lah, ataupun boleh buat establish your own home visiting kan, macam tu. So it's a bit quite good in the term of salary, but in the government sector it is limited lah. Career pathway in the government is a bit limited compared to the private sector, because in the government sector dia lambat dia punya apa orang kata, dia berdasarkan kekosongan jawatan tu sendiri. If there is, kalau nak naik pangkat kena ada tunggu kekosongan jawatan, barulah ada dia punya pathway dia, ada perkembangan dia untuk career ni. Okay. So compared to others lah, kalau compared to others, career pathway allied health professional ni dia kurang sikit berbanding others professional, sebab dia limited jawatan, limited macam tu lah. Okay. Alright, so the last one is my advice lah. So what are you passionate about? So passion, so as we know passion means that we have strong desire, strong feeling. So when you have strong feeling in something, you will be determined to do something, right? Betul tak?
Betul.
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 So kalau ada passion in contoh you suka untuk treat patient, you suka bila patient tu happy, bila dah buat exercise dia kurang sakit, reduce the pain, improve their movement like that. So this will bagi motivation kat you all lah, bagi motivation. So macam mostly kat sini daripada kuliah apa? Mostly
HS.
apa? Kuliah apa?
HS.
Pelbagai.
Human ni
Human Science.
Human Science. Human Science lagi? Ada course apa lagi kat sini?
Ekonomi.
Ekonomi.
Accounting.
Accounting lagi?
Education.
Bahagian medical tak ada So tak ada medical kat sini? Tak ada allied health profession,
Semua
tak
minat
ada?
medical.
Semua minat
Minat.
Okay. Okay, macam ni. So when you are doing something, you must have passion. So macam you all kan sekarang dalam account, dalam human science, you all ni sebab apa you all berada dalam course ni? Sebab you minat ataupun sebab you all ikut kawan-kawan? Sebab apa?
Minat.
Tanya diri sendiri.
Minat.
Minat, sebab you minat kan? So bila you minat something, for example, contoh kita bayangkan skateboard player kan, like skateboard player. So skateboard player ni, diorang akan main skateboard sampailah diorang akan sanggup untuk patah tangan lah, sebab diorang main skateboard akan ada risiko untuk cedera, betul? Cedera, akan ada patah-patah kan. So they will admitted to the hospital. So all of these challenges you must face it. You must face the obstacles, the journey along your to orang kata untuk mencapai apa yang you all passionkan tu. So you must be brave lah untuk menghadapi segala cabaran tu. Macam tu. Like me, I was offered as a head of department, right? So I'm just a freshie in 2019 and was offered in 2021 to be a head of department. So it is a challenge for myself to lead the people under me. So I'm the youngest and I am also have to lead the others physiotherapists who have experience, who have more experience, more than 10 to 20 years experience. Kalau compared to myself, I only have 3 years experience, right? But we have to challenge myself, we have to challenge ourselves to do it, okay? You have to be patient in whatever you do. Macam saya focus on the rehabilitation. Macam you all mungkin human science, minat apa human science? Dia more on apa? Human science? Tadi mana human science tadi? Okay, tak apa.
Macam-macam ada sosio, psikologi, communication, history.
Banyak kan? So you guys can boleh fikirlah untuk ni 4 year ke first year sampai 4 year?
Second year.
So dah boleh fikir-fikirlah untuk akan datang ni macam mana kan? Okay? So you have to be patient. When you have passion, you will be determined. You will be you not fear to fail. You can stop for a while, but you cannot quit from the decision that you have made. Okay? You can just orang kata berehat sekejap kan, tapi jangan quit. Bila you ada passion, you will do something tu dengan bersungguh-sungguh, determination. Alright. Once you stop learning, you start dying. So in the university life, this is the opportunities for you guys lah to explore more. If you are diberikan tugasan kan untuk to be the leader of the society, the program manager of the program, any program, to be to conduct any program lah. So during this year, during the university life is your opportunities to develop yourself, because at the end of the day, when you are in the career path, in the dah alam dewasa, dah bekerja ni, you have to use back again your skills that you have learned during your university life. Okay. So tapi university life ni dia just a little bit of the orang kata kehidupan yang sebenar, just sedikit saja. You just learn how to be a leader kan, macam banyak kena conduct program apa semua. I think you akan gunakan semua skills kat universiti ni akan digunakan sewaktu bekerja nanti. Okay. So you must keep learning and keep learning. Okay. So knowledge is very important lah. So dia bukan waktu bekerja baru you all nak baru nak ada skills tu, macam soft skill kan. You start from now. Bila ada start from now, dia dah terbiasa daripada awal. So bila dah terbiasa daripada awal, you can be a great person lah. At the end of the day, you can be a great person. So challenge yourself, learn and be a productive student lah. Alright? Involve in many programs, because one day you will realize that the skills that develop during the university life is very important when you are into the career pathway. Okay, so I think that's all from me. If you have any question, you can ask me. Alright? Okay.
Okay. Okay, so Alhamdulillah.
Ada question tak?
Ada.
Okay. Ada?
Ada dalam chat box.
Okay, ada chat box.
Sebelum tu, okay, jadi saya baca.
Okay.
Okay. Thank you so much for this enchanting sharing session, Sister Atikah. Thank you for the meaningful and beneficial sharing based on your experiences. And now, ladies and gents, if you have any other questions, you may drop it in the chat box or open your mic to ask a question, insyaAllah. Okay, so ada soal dari chat box saya bacakan untuk Sister Atikah.
Okay.
Ada soalan daripada Brother Mirza Faiz. What are the areas where physical therapists are expert?
The areas expert. Macam saya cakap tadi kan, the areas of practice. Kan ada banyak kan? Ada banyak. Kita ada banyak bidang, tapi kita ada specialties. Contohnya kalau specialties ni macam saya cakap tadi lah, dia ada specialization. Contohnya dalam vestibular contoh, vestibular ni maksud yang patient tadi tu yang dia ada vertigo. Yang tu contoh pertama. Dia ada banyak sebenarnya specialties. Maksudnya dia ada kepakaran dalam bidang tu kan. Contoh vestibular tadi. The second one untuk lymphedema, kes-kes yang lymphedema ni pun sama. Dia biasanya ada certificate lah untuk macam swelling of part of the body kan, kita kena bagi dia massage yang ikut dia punya teknik lah. Tu kes lymphedema. Other than that, macam women health pun sama. Dia ada specialties, kepakaran dia. Women health, dia perlu ada kepakaran to treat the patient with women health condition. Women health ni dia termasuk lah yang tadi macam organ prolapse tu, maksudnya you rahim jatuh tu kan. Tahu yang tahu tak? Macam tu banyak program organ-organ bahagian dalam tu dia jatuh, dia sebab muscle dia lemah, so that dia prolapse. So what we are doing, we will teach the patient. So basically tadi soalannya tentang kepakaran kan?
Ya, dia tanya area yang physical therapy expert lah, paling expert.
Expert macam tu lah, continence therapy, vestibular rehab, neuro, musculoskeletal. So mostly kita involve in many fields. Cumanya macam orang kata, dia kata kepakaran tu sebab apa? Sebab fisioterapi kena ada sijil untuk certain area tu. Contoh macam tadi vestibular, women health, apa lagi tadi, lymphedema, tu antaranya lah, antara some of the area of practice yang need specialization. So they need certificate lah untuk buat benda tu. Tapi basically untuk semua field, fisioterapi memang treat patient, memang semua. be involved in many field. Tapi cuma untuk certain field like macam tadi saya sebut, yang untuk kes vertigo, vestibular tu, lymphedema yang ada swelling part of the body apa semua tu, and also women health, tu semua dia perlukan kepakaran lah, dia perlu ada sijil yang tertentu untuk dia amalkan, untuk dia praktiskan benda tu kalau ikutkan sebenarnya. Tapi disebabkan oleh limited fisioterapis yang ada kepakaran tersebut, the service still on at the clinic. Dia still ada, walaupun dia tak ada kepakaran tapi still ada praktis tersebut. Sebab kalau tak ada lah doktor nak refer kan.
Betul-betul.
So basically itulah antaranya.
Okay, baik. Saya baca soalan yang seterusnya insyaAllah. Seterusnya daripada Brother Wan Muhammad Nazim. Dia tanya, usually what is the duration of psychotherapy for one session?
Okay, usually the treatment, duration lah biasanya dalam, kalau kat hospital government dalam 30 minutes to 40 minutes sudah memadai dah. Macam tu, sebab dia ramai patients. Kalau in the private sector mostly 1 hour, sebab diorang in the private sector dia lebih kepada business kan, so they will treat the patient comprehensively. So they fokus kepada satu-satu patient, they will treat, diorang akan bagi yang terbaik lah untuk kepada patient. So kalau buat home visiting pun dia basically 1 hour physiotherapy session. Kalau macam hospital kerajaan biasanya dalam 40 minutes tu okey lah, biasanya dalam 40 minutes macam tu. Kalau private dia lebih lama sikit. Tapi kalau untuk hospital pun sama, kalau dia specialization tu macam kes-kes women health, men health kan, yang tu kalau dia ada specialization dia akan lama sedikit lah untuk kita treat patient tu. Dia bergantung juga pada masalah patient tu sendiri. Jadi averagely dia dalam 30 minutes to 1 hour treatment.
Okay. Alright, besar ada lagi soalan daripada Brother Nabil Ahmadi. Have you ever experienced treating patient with mental illness? For example, having mental breakdown after an accident. In that case, will physical therapists work together with psychologists, or do you also specialize in handling this kind of situation? Macam tu lah soalan dia.
So usually yang biasa kalau kita ada patient dekat ward kan, patient tu dia macam tadi kan mental breakdown kan. Contoh macam saya pernah handle one patient ni, dia kematian nenek dia. So dia sangat stres. Sampai dia selalu menangis, mental breakdown lah. So at that time the patient is young, dalam 18 years old. I'm not mistaken lah, 18 tahun. So at that time dia dekat ward, the patient sangat stres, hari-hari menangis. So this is one of my experience lah. So the patient bila dia menangis, dia sangat sedih, so dia punya breathing pun affected. So bila breathing affected, dia nak bernafas jadi pendek nafas dia nak menangis kan macam tu. So dia punya cardiorespiratory status dia pun reduce. Bila reduce, we as a physiotherapist, we will treat the patient based on their condition. Even patient tu ada mental breakdown ke apa, tapi we not treat the mental punya side. Mental is untuk bahagian yang in charge lah, untuk counselling ke apa kan, psychiatrist. Tapi fisioterapi dia lebih kepada kita nak rehab ataupun nak bagi rawatan yang bersesuaian dengan masalah fizikal ataupun masalah-masalah yang berkaitan dengan diorang punya movement ke, diorang punya cardiorespiratory dalam lung, heart apa semua tu. So at that time bila patient ada shortness of breath, dia macam susah bernafas sebab dia terlalu stres, asyik menangis kan. So saya sebagai physio, saya train the patient to have a relaxation technique, untuk breathing technique. Sebab apa? Kita nak bagi patient relax. Sebab bila patient ada masalah-masalah macam ni, macam anxiety kan, we treat the symptom, bukan treat the masalah anxiety tu, bukan. We treat the symptom. Like bila anxiety dia akan ada pernafasan yang laju, rapid breathing. So kita akan train the patient, we will teach how to do relaxation exercise, positioning ataupun positioning the patient untuk in relaxation position lah. So in that area we will focus on the problem that patient have. For example, kalau ada patient yang ada dekat psychiatric ward kan, psychiatric ward kan physio pergi, physio we treat the patient main je macam baling bola ke apa dekat dia kan, so that to improve their mobility, the movement, to improve their social interaction, macam tu lah, macam kita nak improvekan dia punya quality of life dia orang. So we will treat in that aspect, bukan we treat the illness tu sendiri. Kalau illness, doktor punya peranan lah macam mana, ataupun psychiatrist kan, physiotherapist akan treat daripada segi dia punya physically yang limited apa dia, contoh dia tak boleh berjalan, cannot walk independently, so physio will guide, will teach the patient to walk, macam tu lah. So we focus on the functional disabilities of the patient, macam tu. Clear tak?
Oh, clear. Alhamdulillah. Terima kasih. Okay, ada lagi question daripada Wan Muhammad Nazir lagi. Dia tanya, it is possible or relevant to get physiotherapy even though we are healthy?
Oh, even though healthy. Okay, so okay, so tadi I have been mentioned before. So physiotherapy ni dia help injured ataupun ill people kan to improve their movement. Okay, so bila macam contoh patient they complain of pain of their hand, for example they have they have difficulty to grip something, feeling weakness. So bila diorang ni sihat je, tubuh badan semua sihat macam biasa, boleh pergi kerja, cuma they have limited movement in certain movement lah. Contoh patient tu dia kerja kerani kan, jadi dia pegang pen pun sakit dekat area sini, dekat area tangan, dan juga rasa numbness, they will feel pain or numbness kan, tapi physically they are healthy, but there are certain problem in the musculoskeletal aspect. For example, their muscle are weak, so kita as a physiotherapy we will train the patient, to teach the patient how to do the exercises, how to improve the muscle strength. So usually the patient come to the physio department, macam yang datang kat physio clinic kat hospital kan. So they usually they are healthy, cumanya dia ada certain injury that they have, macam tu. Macam tu barulah kita akan treat the condition. Tapi diorang healthy je, diorang bukannya tak rehat. Dia ada condition yang mana yang tak sihat tu, yang macam stroke kan, macam tu dah memang bedridden, they unable to move. So yang tu pun kita treat. So kita treat based on the patient condition, based on patient punya injury. Walau even they are healthy, we are still treating them because they have the injury at other part, macam tu. Kita depend kepada patient complain lah, like that. Macam tadi lah, macam patient tu complain pening-pening kan, padahal dia sihat je tapi pening-pening. Datang hospital, kita akan ajar, kita akan analyse lah, tengok, assess patient, kita akan give the treatment sesuai dengan keadaan patient. Biasanya diorang sihat walafiat dia, tak ada apa masalah, cuma ada certain yang rasa uncomfort, diorang datang hospital, kita akan ajar senaman lah, macam tu, like that.
Okay. Terima kasih. Lepas tu ada lagi soalan from Brother Mirza. Dia tanya, what is the common causes of nerve pain?
Common causes of nerve pain. Nerve pain biasanya kalau nerve ni, berkaitan saraf ni, dia ada punca-punca dia lah. Kalau neurological deficit kan, kalau neurological dia akan berkaitan dengan saraf, kita punya sistem saraf tu sendiri. So kalau macam tu biasa kalau patient yang ada neuro problem, dia akan affect the mobilities, dia akan affect the strength. So basically the neuro problem ni because of the kita punya sistem kita sendiri, neurological deficit of the neuro, dia punya ni lah untuk saraf tu. So bila problem dengan neuro, kita punya brain yang control kan, dengan dia punya spinal cord semua, ada saraf yang tertentu yang problematic, so they will cause some problem lah in the nerve. Sometimes tak semestinya disebabkan oleh brain ataupun spinal cord ni ke apa ke, tak ada, tapi dia sometimes the nerve dia involve sebab apa. Kadang sometimes patient contoh dia ada berkenaan dengan muscle diorang affected kan. Bila muscle affected, contoh dia himpit the nerve, contoh muscle tu spasm, dia jadi keras. Bila keras muscle, dia akan himpitkan bahagian dalam. Jadi bahagian yang dalam yang saraf tu dia akan affected. Bila himpit, so dia akan rasa kebas-kebas. Dia boleh jadi faktor tu jugalah structure kita punya body sendiri. Macam tu. Okey tak? Clear tak?
Alhamdulillah clear. Lepas tu ada lagi second last question. Can nerve damage patient betul lah. Can nerve damage patient be healed 100%?
Can apa nerve?
Can nerve damage
dia boleh sembuh tak?
Betul.
Oh, dia biasanya macam kalau if nerve is injured tapi dia tak cut lah, not cut, the injury is likely to be healed lah. Tapi kalau dia dah completely severe, dah teruk kan, dia recovery dia agak impossible lah. Maksudnya dia ada nerve cut apa semua kan. Tapi doktor dia akan determine the treatment lah. Macam akan ada rawatan, akan ada procedure from the doctors. Tapi biasanya kalau fisioterapi kita akan contoh kalau nerve tu dia just affected, dia tak ada cut ataupun dia tak ada injury kepada dia tak cut tapi dia ada injury, kita boleh treat patient berdasarkan apa exercise apa yang boleh dibuat kan, sebab dia akan ada simptom. Biasanya kalau contoh macam nerve tu dah entrapment of the nerve kan, saraf tu dia tersepit contoh entrapment, so dia akan ada simptom kebas, dia akan simptom lemah, pergerakan tertentu. Jadi fisioterapis dia akan to teach the patient to improve the strength, to reduce the numbness, macam tu. So yang tu untuk part fisio yang bila mana nerve dia tak cut, dia not cut or lagi teruk lah, severe condition. Tapi kalau dah teruk yang berkaitan dengan nerve, kita tak mampu untuk completely heal the patient, tapi kita dapat improvekan macam neuro patient kan, neuro patient we have to retrain the patient to gain the movement again. So kita akan ajar patient macam mana nak dapatkan pergerakan, contoh macam pergerakan tangan dia tak dapat nak gerak, kita akan ajar the brain untuk macam mana nak selalu gerak pergerakan selalu. Jadi dia akan train the brain to get the movement back. So dia depend on the patient prognosis jugalah. Patient kalau neuro ni dia ambil masa yang agak lama lah, lama sampai kadang bertahun untuk heal balik kan, sebab dia neuro problem yang teruk. Tapi kadang sometimes kalau berkenaan dengan saraf yang just biasa saja, yang just tak ada injury ke apa, yang tu boleh ditreat oleh fisio lah, kita dapat kurangkan simptom. Tapi if fisio tak membantu dalam kurangkan masalah, we are not able to help the patient to improve their movement ataupun nak improve the muscle strength ke apa ke, tu akan ada doctors punya side lah macam mana tu cater that problem lah. Okay, right.
Okay, Alhamdulillah. I think itu je questions. So yeah, insyaAllah. Okay, jadi wait.
Okay, that's all.
So
Alright.
Yeah, betul insyaAllah. Thank you for your insight, Sister Atikah. Okay.
Alhamdulillah.
Today's
Better.
Alhamdulillah. Today's session is about to end. It was informative and we really hope you guys enjoy it too, inshallah. Okay, if you guys enjoy this session, please type any emoji in this comment section if you like. Okay, inshallah. Okay.
Ada apa emoji?
Tak, kalau macam enjoy this session, just put
Okay.
Okay. If ada lah, if tak ada, it's okay. Alright. So inshallah, we have photography session. So please be remind that feedback form dah di-share. So boleh isi form untuk feedback dan juga attendance form, inshallah. So everyone, we are now at the end of our session. On behalf of the organizing committee, I'd like to apologize for any shortcomings. Before we end, I would like to remind you to stay in the meeting for a while for the photography session. And once again, don't forget to fill in the attendance and feedback form given in the chat box. We will highly appreciate if you join us in SITC IIUM family. The membership link is in the chat box. You guys are warmly welcome to SITC as we will organize more and more beneficial programs for all of you, inshallah. We are now at the end of our event and let's take some pictures for memories. So we would like everyone to open your camera and present us your biggest smile. Okay. Are you guys ready? Siapa-siapa yang boleh buka kamera tu, bolehlah buka insyaAllah.